My name is Guerra. This is my first year helping out with Emma's Helping Hands, and I was able to serve in a role as somewhat of a practitioner and also a nurse. And this is my wife Riley, who was able to come with me.
It is also my first year, and I was able to work in triage as well as pass out nutrition supplements.
Hi, my name is Josh Guerra, and this is my first year helping at Emma's Helping Hands. And day one, I was a prayer person in crowd control, and the next day I was a nurse's aide in crowd control again to make sure that we took everybody's information down before they were triaged and seen by the doctors.
I'm Braswell Deen. This is my second year with Emma's Helping Hands, and my role is a physician on the team to provide medical care for people in various clinics.
My name is Braswell Deen. This is my second year with Emma's Helping Hands. I'm the president for Emma's Helping Hands, and when we did the medical clinics, I was nurse's aide.
My experience so far has been amazing. I mean, this organization has been wonderful to serve with. Being able to serve the Lord in any capacity is always an amazing opportunity, but to do it at this scale, going to a different country, and doing it in a remote village and more of a city life, to see the differences, to be able to help different types of people struggling with different types of things, being able to pray for them, having people ask for prayer, I was just blown away.
One of the biggest challenges I thought was working in a hospital in America. We have blood work, MRI, CT, any kind of imaging we want, and we don't treat something until those tests have been done and point to a certain diagnosis. Whereas here you have to solely focus on your physical assessment, how the patient is reporting how they felt the past few days, and go based off a diagnosis based off that. That was really challenging to move from. And it was really amazing to be able to have such amazing interpreters and translators to help us understand what these people were going through.
Yeah, I completely agree, and to piggyback off of that, just the resources. We have electricity and running water in the U.S. and ongoing supplies of medicine and medical supplies. It's just not available here, so it makes it extra difficult.
So this year, like last year, we had to plan everything before we came. We had to create a big spreadsheet and think about all the different kinds of medical conditions we would treat, how we would treat them, how we would dose them by age or weight of the patients, and then we had to make sure we planned out how many patients we intended to see and then order the appropriate amount of medications with using the budget that we had. So it was several months worth of work. Even before we arrived in Zambia, all of our medicines were ordered in Zambia so that the medications were all familiar to the patients and to our volunteer pharmacists who were distributing the medications.
The most rewarding has been having, just seeing all the volunteers come, especially from the United States, to just see, how it is and feels, to give back and to just see, the community that we're working with. And also just to kind of, the local volunteers that we have. When we started, it was all about, my sisters and my brothers, just us siblings. It was very small. And now, adding people who, whether it's, bringing volunteers in who are doctors, who are pharmacists, just all these different careers coming together, trying to give back, has been really just great to see. And yeah.
Yes, I would 100% do this trip again. Being able to work with the people of Emma's Helping Hands has been an awesome experience to see what they're doing here.
Yes, absolutely would do it again.
Yes, 100%. I would do this trip again. I definitely pray about it first, but I would love to be a part of this team anytime, any year that I can go. 100% yes, I would go again.
Make I feel the vibe, where the roots stay deep and the spirit they alive.